Hey everyone, welcome back to the channel. Today we're diving into an important topic, 10 health warning signs women should not ignore. We're going to break down each warning sign, discuss what to look out for, and explain why it's crucial to take action. Remember, early detection is key to staying healthy and living your best life. Make sure to hit that subscribe button and ring the bell for more health tips and advice. Let's get started. Have you ever stepped on the scale and noticed a significant drop in weight, even though you haven't made any major changes to your diet or exercise routine? While many of us might welcome unexpected weight loss, it's crucial to remember that it's not always a good thing. Unexplained weight loss, typically defined as losing 5% or more of your body weight over 6 months to a year, warrants a conversation with your doctor. It can be a symptom of serious underlying medical conditions. For instance, an overactive thyroid or hyperthyroidism can rev up your metabolism and cause unintentional weight loss. Certain cancers, such as those affecting the digestive system, can also lead to weight loss due to their impact on your body's ability to absorb nutrients properly. Other conditions like diabetes, Crohn's disease, and even heart failure can manifest as unexplained weight loss. If you notice that you're shedding pounds without any conscious effort, don't brush it off. Schedule a visit with your healthcare provider. They can assess your overall health, run some tests, and determine if there's any cause for concern. Early detection and diagnosis are crucial for effectively managing any underlying health issues. We all experience fatigue from time to time, especially in our fast-paced, modern lives. However, there's a difference between feeling occasionally tired and experiencing persistent, overwhelming fatigue that interferes with your daily life. Persistent fatigue can be a sign of several underlying health issues that require attention. One of the most common culprits behind persistent fatigue is iron deficiency anemia. This condition develops when your body lacks sufficient iron to produce enough red blood cells, which are responsible for carrying oxygen throughout your body. Another possible cause of persistent fatigue is a thyroid disorder. An underactive thyroid or hypothyroidism can slow down your metabolism, leaving you feeling sluggish and fatigued. Beyond anemia and thyroid issues, persistent fatigue can also signify heart disease. Additionally, mental health conditions like depression and anxiety can manifest as physical symptoms, including persistent fatigue. If you constantly feel exhausted, even after a good night's sleep, it's essential to pay attention to your body's signals. Breathing is something we often take for granted. However, when you experience shortness of breath, that effortless breathing can become a frightening struggle. Shortness of breath, also known as dyspnea, is the feeling of being unable to catch your breath. It's essential to remember that shortness of breath is a serious symptom that should never be ignored. One of the most common causes of shortness of breath is asthma. Another potential cause of shortness of breath is heart disease. When your heart isn't functioning correctly, it can't pump blood efficiently, leading to a buildup of fluid in the lungs. Shortness of breath can also be a symptom of a pulmonary embolism, a potentially life-threatening condition that occurs when a blood clot lodges in an artery in the lungs. This blockage can prevent blood flow to the lungs, leading to shortness of breath, chest pain, and coughing. If you experience shortness of breath, seek medical attention immediately. Our skin is the largest organ in our body, acting as a protective barrier against the outside world. Changes in our skin can sometimes be a sign of underlying medical conditions. One of the most important changes to watch out for is the development of new moles or changes in existing ones. Melanoma, the deadliest form of skin cancer, can manifest as a new, unusual-looking mole or a change in the size, shape, or color of an existing mole. Remember the ABCDEs of melanoma: asymmetry, border irregularity, color changes, diameter larger than 6 millimeters, and evolving. Beyond melanoma, other skin changes can indicate different health issues. For example, a sudden onset of severe acne in adulthood could be a sign of hormonal imbalances, such as polycystic ovary syndrome or PCOS. Yellowing of the skin or eyes, known as jaundice, can be a sign of liver problems. Paying attention to these changes and consulting a dermatologist or healthcare professional for an accurate diagnosis and treatment plan is essential. Every woman's breasts are unique, and it's normal for them to change throughout different stages of life. However, being familiar with your breasts and noticing any unusual changes is crucial for early detection of potential issues, including breast cancer. One of the most common symptoms of breast cancer is a new lump or mass in the breast or underarm area. These lumps are often painless, hard, and have irregular edges. In addition to lumps, other breast changes can also be warning signs. These include changes in breast size or shape, skin dimpling or puckering, nipple inversion, redness or scaliness of the nipple or breast skin, and nipple discharge other than breast milk. If you experience any of these changes, it's essential to consult your healthcare provider promptly. We've all experienced the discomfort of occasional abdominal pain or bloating. However, persistent or severe abdominal pain or bloating that lasts for an extended period can be a sign of something more serious. One potential cause of persistent abdominal pain is irritable bowel syndrome or IBS, a common disorder that affects the large intestine. IBS symptoms can include abdominal pain, cramping, bloating, gas, diarrhea, and constipation. Another possible culprit behind persistent abdominal pain is endometriosis, a condition where the tissue that normally lines the inside of the uterus grows outside of it. In some cases, persistent abdominal pain, especially when accompanied by bloating, can be a sign of ovarian cancer. Ovarian cancer often doesn't cause noticeable symptoms in its early stages, making it crucial to pay attention to subtle changes in your body. If you're experiencing frequent or chronic abdominal pain, it's essential to listen to your body and seek medical advice. A woman's menstrual cycle is like an internal clock, regulated by a delicate balance of hormones. While some variation in menstrual cycle length and flow is normal, significant irregularities can be a sign that something's off balance within your body. One common cause of irregular periods is polycystic ovary syndrome, or PCOS, a hormonal disorder that affects women of reproductive age. PCOS can cause irregular periods, missed periods, or prolonged menstrual bleeding. Another potential cause of irregular periods is thyroid disorders. An overactive or underactive thyroid can disrupt the delicate hormonal balance necessary for regular menstrual cycles. Stress, whether emotional or physical, can also impact your menstrual cycle. If you're experiencing irregular periods, it's essential to understand the potential causes and seek medical advice if needed. Chest pain is a symptom that should never be ignored. If you experience sudden crushing chest pain that spreads to your arms, back, jaw, or neck, accompanied by shortness of breath, sweating, nausea, or lightheadedness, call emergency services immediately. These could be signs of a heart attack, a life-threatening condition that requires immediate medical intervention. Even if your chest pain isn't as intense or accompanied by other symptoms, it's still essential to seek medical advice promptly. Angina, a type of chest pain caused by reduced blood flow to the heart, can also be a warning sign of heart disease. Other potential causes of chest pain include pericarditis, aortic dissection, and pulmonary embolism. Headaches are a common ailment that most of us experience from time to time. While most headaches are benign and resolve on their own, frequent or severe headaches, especially those accompanied by other symptoms, can be a sign of an underlying medical condition. If you experience sudden severe headaches that come on quickly and are described as the worst headache of your life, it's crucial to seek immediate medical attention. This type of headache could be a sign of a subarachnoid hemorrhage, a life-threatening condition where bleeding occurs in the space between the brain and the surrounding membrane. Migraines are another type of headache that can cause severe pain, often on one side of the head. Other potential causes of severe headaches include meningitis, encephalitis, and brain tumors. It's essential to consult your healthcare provider if you experience frequent or severe headaches, especially if they interfere with your daily activities or are accompanied by other symptoms. Our eyesight is precious, and any changes in our vision should never be taken lightly. If you experience sudden vision loss, blurry vision, double vision, flashing lights, floaters, halos around lights, or eye pain, it's essential to seek immediate medical attention. These could be signs of serious eye conditions like retinal detachment, macular degeneration, glaucoma, or optic neuritis. Diabetic retinopathy, a complication of diabetes, can also cause vision changes, including blurry vision, floaters, and vision loss. High blood pressure can also damage the blood vessels in the eyes, leading to vision problems. It's important to have regular eye exams with an ophthalmologist or optometrist to detect and address any eye health issues early on. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with your friends. By being aware of these warning signs and seeking medical advice when needed, you're taking proactive steps towards protecting your well-being. Your body is constantly communicating with you, and it's essential to listen to its signals. Early detection and treatment are key to managing health issues effectively. Don't forget to subscribe for more health tips and stay healthy.